Perhaps you or someone you know is left-handed. Did you know that left-handedness is strongly linked to alcoholism, smoking, drug use, homosexuality, schizophrenia, and other psychopathological conditions, a number of behavioral problems, sleep problems, allergies, headaches, immune system difficulties, and increased criminality or antisocial behaviors? For example, one study conducted by Dr. Stanley Coren looked at 64 alcoholics receiving therapy for their problem. Patients who were left-handed had nearly 3 times as many relapses. Among patients who had the most trouble avoiding alcohol for 6 months, 86% were left-handed. Unfortunately, it seems that left-handers are subject to a variety of problems that have strong negative health implications. However, health implications are not the only problems for southpaws. According to Chris McManus's research on handedness, left-handers are 89% more likely to have an accident-related injury than a right-hander, whether at work, home, while playing sports, using any kind of tool, or driving. On top of health issues and apparent clumsiness, left-handed people also deal with numerous beliefs and stereotypes about handedness. Proof of negative attitudes toward left-handedness surrounds any language. Left in English comes from the Anglo-Saxon word lift, which means weak or broken. The Oxford Dictionary defines left-handed as meaning crippled, defective, awkward, clumsy, inept, ambiguous, doubtful, questionable, ill-omened, and illegitimate. A left-handed compliment is actually an insult. A son from the left side of the bed is illegitimate. A left-handed marriage is an unconsecrated or adulterous marriage. Since a number of differences between left and right-handers are evident, this suggests that the psychology, development, personality, and behavior of left-handers may differ from those of right-handers. Of course, left-handers would be categorized as clumsy and awkward. They live in a world designed for right-handed people. Tools, games, language, etc. are designed with right-handed people in mind, and on top of that, most teachers pay little attention to handedness. School could be a much easier place for a left-handed child if teachers considered how handedness affects a child's actions and learning. According to Jack Fincher's book Lefties, making a left-handed child switch to their right hand is not the best solution. Left-handedness is not a simple movement preference that has developed into a habit, but probably reflects differences in the pattern of neural circuitry in the brain. The average right-hander may be surprised by the idea that left-handers are stereotyped and may deny any feeling of superiority. The following snippet of conversation was used in an experiment conducted by Stanley Coren. How did it go? He acted like a complete blank. In the experiment, the blank was filled with left-hander, and a group of university students were asked to interpret the intended meaning of the second speaker. 91% of the group described the second sentence as indicating that the subject was clumsy, socially inept, dumb, out of place, rude, etc. The remaining 9% were non-committal in their responses. Of 104 responses, not one was positive, showing that there is in fact a negative stereotype about left-handers. If left-handers were a visible, recognized minority with specific needs, changes could be made in the environment without too much difficulty. 13% of the world's population is left-handed, so it is probably likely for certain mass-produced items to be designed for both left and right-handed people. Possibly the first step of redesign would be to gather information about the places and situations in which left-handers have the most accidents or difficulty. Another way to accommodate left-handed people and keep driving accidents down is to prepare driving instructors to teach left-handed drivers. The instructors should be prepared to add additional instruction and training when dealing with a left-handed student. Classroom teachers should also be specifically trained to teach left-handed students to write left-handed instead of trying to switch them to the right hand. Perhaps physicians and doctors should be more aware of the health implications left-handers are more prone to face. Such knowledge might be useful during treatment and research. Death records and hospital records could routinely list handedness information so we could learn more about handedness. The first step towards solving many of left-handers' problems and discomforts is for our society to become aware that they exist. Left-handers are a very large minority. The largest single racial minority in the United States, African Americans, make up only 12% of the population. Left-handers make up 13%. The second step is to make left-handers aware of their own differences. Left-handed organizations need to focus on advocacy and their rights. There are 30 million left-handers in the United States. They deserve some recognition and a better quality of life. Right-handers and left-handers can coexist. Both have needs, and both can make the world safe for diversity.